So we're going to have a quick overview of DSPD intake and our waiting list. First things first, what is a waiver program? So DSPD actually runs 4 different waivers right now. We do have about 8 Medicaid home and community-based waivers. Some of those are run through Department of Health. We recently have had a consolidation, so now we are the Department of Health and Human Services. Officially, that begins in July, so we'll be all under the same executive directors. But a Medicaid waiver allows federal and state-funded programs to waive certain Medicaid statutory requirements to allow states to provide greater services to people living in the community. We run the Community Supports Waiver for individuals with intellectual disabilities and related conditions, the Acquired Brain Injury Waiver, and the Physical Disabilities Waiver. We also have a new program called the Limited Supports Waiver for individuals, and I can go over that at the end of this as well. So eligibility criteria for the Community Supports Waiver. Again, this is for individuals with intellectual disabilities or related conditions such as Down syndrome, autism, fetal alcohol, cerebral palsy. We do have a lot of additional diagnoses that can be considered a related condition. So we do look at a lot of new information and take that to our eligibility committee when we have new diagnoses to review. We also need to have some documentation for medical diagnoses. So for Down syndrome, for cerebral palsy, for fetal alcohol, that information comes from a doctor specifically. When you start the intake process, you can actually talk to your intake worker about what is needed for that specific diagnosis. They can help walk you through and talk to you about what we need for each one. So not only do you have to have a eligible diagnosis, you must also meet 3 out of 7 functional limitations. So our intake workers review all of the information that's been submitted for the client. They review the psychological evaluations, developmental assessments, medical documentation, and they also do what's called a needs assessment questionnaire. This helps them determine if people meet 3 out of the 7 functional limitations. So those are self-care, expressive and receptive language, learning, mobility, self-direction, capacity for independent living, and economic self-sufficiency. So they work with the family or the individual to complete the needs assessment questionnaire and the Form 19 that goes over each of these functional limitations. For an actual intake for the Community Supports Waiver, we do need to have a psychological evaluation for anyone over the age of 7. That testing that needs to be completed, we need IQ testing. We need adaptive testing for everyone applying. We also need autism testing if that's applicable. A developmental assessment can be submitted for clients under the age of 7, and usually we do get those from the school or from early intervention. And school documents, that's a question that we get all the time. I like to always start with school documents, with IEPs, because it really does help us understand what additional testing we may need to order or what the family may need to, what other documents the family may need to find. So an IEP and team evaluation summaries can be used as collateral information. We can't necessarily use that as a psychological evaluation if it hasn't been completed by a Psych D or a PhD, but we might have enough information looking through the school documents to get what we call a consult. So a consult is completed by one of our contracted providers. They review the information that's already been completed and make a report basically using that information and then assign a diagnosis as a PhD or a Psych D. So that's actually a faster way to get what we need for eligibility, and it also makes it so the person doesn't necessarily have to do the same testing over and over again. So sending in that information is really very helpful for us. Like I said, too, the medical diagnoses, we do require a doctor to give us an ICD-10 code, which is just a billing code. We have a form for that we can submit to your doctor for you, or you can submit that to your doctor to send back to DSPD. So eligibility criteria for our acquired brain injury. waiver is a little bit different. We do have to have a documented medical diagnosis of an acquired brain injury. So we do need that ICD-10 code. We have a list and a division directive that goes over all of the diagnoses that are accepted for this. Sometimes we'll get a code that isn't correct, and so we have to go back to the doctor and ask them for something more specific. In most cases, we also need medical documentation that goes over the actual injury and what occurred. So sometimes that can be from the original injury or possibly later documentation that's been completed. So we look from that from an MD or a DO. They don't have to submit a psychological evaluation for this specific waiver. The one criteria for ABI the brain injury cannot be a result or solely due to mental illness or substance abuse or any kind of deteriorating disease like multiple sclerosis or Huntington's. Cognitive brain injuries like a stroke can sometimes qualify, but things like dementia and Alzheimer's do not qualify. You do also have to have the qualifying diagnosis and meet at least 3 of 7 functional limitations. They are a little bit different than the community supports waiver, so that is memory or cognition, activities of daily living, judgment and self-protection, control of emotions, communication, and physical health and employment. So this waiver is for people over the age of 18. They do have to have the medical documentation to support the brain injury. They do complete the social history, which is part of the intake packet. And then they complete what's called the comprehensive brain injury assessment. So we have our intake workers meet with families and individuals to complete this actual assessment. So it is a face-to-face assessment. We also do the needs assessment questionnaire as well to rank people on the waiting list after this whole system has been completed. So eligibility criteria for our physical disabilities waiver. This program is designed to provide services to people with physical disabilities to help them remain in their homes. So clients must be over the age of 18, and they also have to have a functional loss of 2 or more limbs. So we do actually have nurse case managers who run this waiver. They help the individual with the intake packet. It's a little bit different than our packet specifically. It has some information that doctors sign and submit. So they need a physician diagnosis, an accompanying ICD-10 code. They do have to have the functional loss of 2 or more limbs and require nursing facility level of care. They do have to be able to self-administer their own program and be capable of selecting and supervising their attendance. So there are limited services on this waiver that are listed: the financial management service, personal assistance, personal emergency response system, and transportation. So Christina is actually the worker who does all of the physical disabilities applications and works with the individuals and families for this waiver. So how does someone start an intake? We have 3 different ways that you can do that. You can call the intake line to speak to an intake worker. Somebody is available on that intake line 5 days a week, 8 to 5, Monday through Friday. There are 2 people assigned daily, so we try to limit wait times as much as possible. So people can call and ask specific questions. The intake worker can send out the 1-1 form, which is just basic information to get started. They can send you the full packet if you request it, or they can actually send you to our online application. We do have an intake packet on our website. The link is provided here. All of the intake packets are included. You can actually print those off if you'd like. They are PDF fillable now, so you can download them and fill them out on the computer, which makes it a little bit easier. And you can also apply online. So mysteps.utah.gov is our online eligibility and intake portal. So individuals or families can go in and create their own account. You actually fill out the social history and provide information directly to submit your application. You can also upload your own documents if that is easier. Any of those 3 ways will work. The intake packet has the intake line information on it if you have to call with questions. It also has an email where you can scan and email that application back to get started. The next step, once you've started the intake process, an intake caseworker is assigned. So the 1-1 or the intake packet or an online application can be submitted, and we will assign that to an intake worker. The caseworker will look at all the information and see if there's anything else that they need to request from the family or the individual. The social history, the release of information, those are included in the packet. If you do the online application, you'll do the social history there. We can give you a release of information to sign if you need help requesting those documents. So we are expecting that the client or family can send us a copy of the Social Security card, birth certificate, and guardianship paperwork if applicable, copy of the Medicaid card and Social Security income, psychological evaluation or developmental assessments, including school records, and medical records for medical diagnosis. Like I said, we do have that release of information. If it's filled out properly, we can also help the family request these documents so they don't have to try to collect everything. I do tell families with school-age children or young adults that they should get the information from the school first, just to make sure that they've got that going for them. So the intake worker will reach out to the family to help them with the application if needed, and they'll go over next steps. So typically after they've received everything that they need, they start to do the assessments that we need to do for DSPD, which is our needs assessment questionnaire, our Form 19, or the comprehensive brain injury assessment if needed. So an eligibility decision, once the division assessments are completed, the intake caseworker will review all of the documentation and determine eligibility. So once those assessments have been completed, they'll review everything and look at eligibility. After this, the family will receive a notice of agency action notifying them of the decision. If approved, the person's name goes on the waiting list. If not, the person can send a form to start the division resolution process. Once you're on the waiting list, your intake caseworker will send you contact information for your waiting list worker if your case needs to be transferred. The waiting list is not first come, first served, but based on need. There are 3 areas that the needs assessment questionnaire measures, and the information is used to rank all of the clients on the list. So severity of need, caregiver support, and time on waiting list are the 3 areas that we look at specifically. So each year, our waiting list caseworkers will contact each person or family to update the waiting list survey and the needs assessment questionnaire. Families and clients are encouraged to contact their waiting list worker to make updates if there are crisis situations. People can call and update information at any time. We make sure that our needs assessment is up to date and completed at least once yearly, but we do have families who call with new information pretty frequently, and we can make those updates at any point. It just included some additional resources and information for Social Security, Medicaid, Voc Rehab, the Utah Parent Center, and the Independent Living Center. Do you have any questions at all about the intake and eligibility process? I'll go over a little bit about the limited supports waiver, since that is a new waiver that we just were approved for this year. It isn't a new waiver that people have to apply for. It is a waiver designed to help individuals to be more independent. It's a capped budget at $16,000 a year. It kind of is the opposite of what our community supports waiver is, where the highest need brings people into services. These are people with the lowest need who can have services in their home or in the community, limited services to make sure that they are successful in meeting goals. And so right now, I think we have about 50 people on that waiver. We are currently adding more people to that waiver, and the legislature can actually give money and or funding for both the community supports waiver, which they call the comprehensive waiver, and the limited supports waiver. You can be on the limited supports waiver and also stay on the waiting list for the comprehensive waiver. If you have needs that change, there will be a process to look at that as well. But it's designed to help take some of those folks off of the waiting list who have limited needs and can be supported with limited services in the community. It doesn't include things like day programs or any of the residential services, because it's meant to help that person either live independently or live at home with some specific supports. It's very goal-oriented. There have been a lot of success stories over the last year about people just having enough support to really learn a lot of tasks, learn how to cook and to clean and to do different things on their own, start small businesses, even things that they may not have had the ability to do before because they didn't have the right support. So there's a lot of different supports that have been included as well in that waiver that we don't necessarily have on the comprehensive waiver. So we're excited to have more success stories on that waiver for people really being able to live independently. I can also go over some of the services that are provided on the comprehensive waiver, if that would be helpful.
I think that would be great. Just like once you're on the wait list, what happens next? Like once you're able to get those services, that would be super helpful.
Yes. So when you transition into services, so when you're pulled from our waiting list, a transition worker is assigned, and they go out and they meet the individual and or the family, and they come up with a basic plan. Obviously, there's intake paperwork, but they talk about a schedule of services. They go over goals. They talk about what things might be helpful for that individual to be independent as well. So a lot of the services that are provided all the services that are provided on the comprehensive waiver are by choice. And so individuals can change their minds and they can change what services they want over time. So obviously the services for somebody who is younger, it's going to look different than a young adult or an adult in the system. So it really it depends on their age. Everything we do is person-centered. We do a lot of person-centered planning to come up with a plan for people to meet those goals and do things that they find important as well. So some of the services that we do provide, I think everybody knows already about respite care. We do have respite care. We do what's called the self-administered model. We also do have the provider model. So self-administered services, the family and the individual actually hire the individual to provide that care for them. They're responsible for the training of that individual, and then they actually work through a fiscal agent to pay that person directly for the care. You have what's called supported living. That's also self-administered and or provider-based. That's a one-on-one service to help people with skill building. You can also go out in the community and do a lot of social activities, transportation. Sometimes people will get help to go to doctor's appointments or vocational rehab. So supported living can help them with a lot of different things in home too. They can help with cooking or cleaning and scheduling things that individuals might need. We do have chore services and companion services, day support, which is typically like a day program. A lot of those are more community-based now, so some people will go to a day program every day. We do have environmental adaptations, host home services, which is the actual family that an individual would live with. It's a residential setting, but it is an actual host family, whatever that makeup looks like. They usually have a room in the home and they pay room and board. And then DSPD provides the supports needed to those individuals. We do have residential supports as well, and that looks like a group home setting. A group home setting is not an institution. It is a house or an apartment with other individuals with disabilities that's staffed 24 hours a day. So there's staff in there usually it's up to 3 roommates, and each roommate may have their own plan and their own system, and it may have different things that they do throughout the day. They may go to a job, they may go to a day program, and there's staff there to help them with the transportation needs, to help them with cooking and cleaning. So typically the group home model is for people who need more care. Supported employment, we do work with VR after people have received job services and job coaching. We can continue paying for job coaching and employment preparation services for those individuals. Support coordination obviously is a big one. Everyone on the waiver has a support coordinator. They're external contractors, and that is by choice. Somebody can choose any support coordinator they want to work with, and they can actually change their mind and work with someone else as well, whatever is needed. Transportation services, that usually goes with day programs, but we also do offer UTA and different options for people who might be more independent and can take the bus system where they need to go. That's a very basic overview of all the services that are provided under the comprehensive waiver. The brain injury waiver, there are a lot of similar services. They do offer massage therapy as well on the brain injury waiver, and I think that actually is an option on the comprehensive waiver now. The limited supports waiver has their own set of supports that they're looking at getting, and a lot of those are kind of brand new and a little bit different than the comprehensive waiver. Any other questions? Anything else I can go over?
I don't have any additional questions. This has been super helpful. Thank you. Thank you for sharing all the resources with us as well, so we can share that with our families.
Yeah, and please let me know. You can give out my contact information if families want to ask questions about where they are in the process or how to start the process. We do want to help families feel comfortable with the intake process. We don't want it to be overwhelming, so we can kind of help break down those steps for people so they don't feel so overwhelmed. The packet looks a lot scarier than it is because so many pages, but there's definitely ways, like we can do things over the phone if that's easier for individuals. We can meet in school meetings, whatever the situation might be. If those individuals need more support to complete the intake, we want to help with that. We do find people will start the intake process. They won't finish it without support. So we do want to help people follow through and make sure that we have everything that we need. We do have a 90-day timeline when we first start an intake, and it's basically for our system, but it doesn't mean that all of that information they've already submitted is gone. That we send out a letter after 90 days just saying like, hey, are you going to send in this additional information? Do you need our help? What can we do? And I think sometimes that scares families. And they think, oh, now all my information is gone. I have to do this again. You don't. So we can make the updates in the system. We can update the social history. And then we can we want to be able to help people collect the documentation. So doing that release of information appropriately and putting the school's information in there, or, any psychologist or medical doctor, we can help request those documents for families so they don't feel as overwhelmed.